Hello there. My name's Andrew Hart, and I'm one of the academics who teaches on the Public Health and Community Wellbeing degree. And I'm just going to go through some key features of the program, in case you're wondering, why should I study Public Health and Community Wellbeing? I'm just here to give you a quick summary, and there's more information available on the website, which I'll mention at the end of this short presentation. The key points that I want to make, to get cut to the chase, are that there's never been a better time to study public health and community wellbeing. The COVID pandemic has shown us just how important public health is in everybody's lives. Okay, this is the kind of stuff that touches everybody. It's important to everybody, and it's important that we have loads of people who have a key understanding of these issues, and they're going to be the public health leaders of the future, so that we know how to get these things right. You'll realize that a lot of this is about judgment calls. Sometimes we get things right, sometimes we don't, and we've been taken through this roller coaster over the last 18 months, and we need to improve the way that we deal with these things. But public health is more than just pandemics and infectious diseases. A degree like this can lead to a wide range of exciting jobs and careers, the kind of thing which is going to mean that no 2 days are the same. It's about working in a dynamic environment, working with people, and if you want, working in research as well. Because the degree really teaches people the skills that employers want. Things like how to communicate effectively, how to work with other people effectively, the ability to understand research, carry out research, and manage projects. Those are the kind of skills that we know employers want, and that's what we develop in you. And one of the ways that we do this is by providing a work placement as part of the degree, so that you can work in the field, you can exit the degree as a graduate with demonstrable work experience, and that is what employers want. That's really what helps people to stand out from the crowd when they're applying for graduate positions. And also, as part of the program, you get membership of the Royal Society for Public Health. So that's just a kind of quick run through the key points. I'll go into a little bit more detail. One of the questions that people often ask is, well, why should I study public health and community wellbeing? Well, you may be aware that the UK is facing lots of health challenges, not just COVID, lots of other ones, and public health has a role to play in all of this. A lot of these problems are preventable. We are bringing a lot of these health issues upon ourselves, and why do we do it? Well, there are lots of reasons why, and part of the degree is about understanding what those reasons are and what we can do about it. How we help people to make positive changes in their lives so that they can stop making themselves ill, so that they can take action and make informed choices about what they do. So for example, the death toll from COVID is horrendous, but a recent report estimates that 64,000 people die a year from poor diet, okay, in England, and that is quite horrendous as well, especially given that it's preventable. So why do we make these choices, and what can we do to help people and communities make better choices? These are the things that you can't just treat with medicine or surgery. Yes, they have a role to play, but we can change people's lives, change many more people's lives for the better through public health interventions. And understanding how we do this and what we do, what works and what doesn't work so well, is really part of understanding public health and working with communities. Some of these are lifestyle issues, social issues, and understanding all this is really part of making those judgment calls about what we do and who we target in society. Okay, I mean, the bottom line is that public health saves lives, many more lives than other health interventions can. But it's often the kind of the slow burn things that go on in the background that nobody notices, because we have to work in different ways when we're dealing with public health. And this is a huge area, so there is scope for people to specialize when they're doing this degree. There might be certain interests you have, certain passions you have, and these are just some of them, looking at how healthy eating, physical activity, substance use, mental health, And of course, communicable and infectious diseases such as COVID. There are others. These are all just examples of what we cover on the program. And there's even an element of how we manage services and work with communities as well. It's very practically focused. So this is just a selection of some of the specific modules that are included in the program. So you can see there's quite a range, and it's about looking at all these issues at different levels. Okay, sometimes we look at individual levels. So we're looking at why people make the lifestyle choices they do and how we can go about changing people's behavior. And then looking at a different level, looking at the global perspective, how the global environment can affect these things. Again, something that was brought into the foreground with the COVID pandemic, the way in which we have global travel and how infectious diseases can spread so rapidly. Looking at mental health, project management, how we actually go about planning a project, managing it, and bringing it to a successful conclusion to make a difference in people's lives. Understanding research, having an epidemiological perspective so we can understand how health issues affect populations and how we understand it, how we can look at what interventions make a difference. That is going to guide our decisions about how we prioritize certain things. And of course, the professional placement, which is where we work with you to select the right placement for you so you can go out and get real world experience. There's just a quick testimonial from one of our ex-students who had such a good time on placement that she got a job. So the people who are teaching on this program are I'm a psychologist, so obviously that goes to the top of the list. We've also got qualified nurses, people who've worked in communities, epidemiologists, social workers, health service managers, sociologists. So quite a range of people, and you can draw on their expertise, their different ways of understanding these health issues. And as I mentioned at the beginning of the presentation, if you go on this program, then you get free membership of the Royal Society of Public Health. We're one of the few universities in the UK that has a university partnership with the RSPH. And just a quick look at where people have gone after they've graduated. As you can see, a range of careers, some people working with marginalized groups in society, other people going into quality assurance, other people going into advice and advisory roles, working with youth offenders, and some people going into human resources. Often organizations these days have wellbeing officers looking at the role of helping people to have effective work-life balances so that they remain healthy and productive instead of going off ill with health issues or stress. Okay, so a lot of this is about preventing things before they become a crisis. Many of our graduates go on to study at postgraduate level, so they're not necessarily going straight into work. They continue their education at a more advanced level, go on to do things like the Masters in Public Health, sometimes go into psychology, social work, teaching, health research. A few of our graduates recently have gone on to do PhDs, and these are the health researchers and perhaps university lecturers of the future. And some people go into leadership and management. Well, you might be asking, what will I be earning if I do this degree? Graduates of the degree typically earn similar levels to graduates from other programs. Okay, I mean, that's partly because the graduate training schemes that you get, for example, with the NHS or the civil service, large organizations like that, they're exactly the same entry requirements as if you did a maths degree or a degree in sociology or psychology. Okay, but also it equips you with your real world experience from placement to enter graduate level posts. So typically the mid 20,000s leading to progression, 30,000 or above, depending on what your aspirations are and what area you choose to specialize in. So that's it. I mean, I could talk for hours about this program, but I've got to keep it brief. If you want more information, please head over to the main website, bradford.ac.uk, and just look up the programme. There's more detail there about the modules that are included, and also contact details of staff members, including myself, if you want to find out more. So yeah, I hope that's been useful. Please do seek out more information and get in touch if you want to. And hopefully in the not too distant future, I'll be welcoming you personally onto campus. Thanks for watching and listening.